Welcome to the broadcast. You're listening to Knife After Death with Dr. Darin Wolfe.
Say, did you ever hear the saxophone let out an awful moan, let out an awful groan? It makes you feel so nervous, yet it's great.
Welcome back, everyone. We are going to do part two of our question and answer. And frankly, we get so many questions, and I get so many questions on a daily basis. There's probably going to be a part three and a part four and a part five, and we'll just keep it as an ongoing series. And I like that. I think it's a fun thing for people to listen to, and they should be kind of like short episodes that kind of hit topics. Although I kind of like it because it makes me feel like Casey Kasem. I'm kind of aging myself a little bit. But when I was young, I used to listen to the top 40, and I almost feel like, and now we have a question from David. David writes, I just feel so very Casey Kasem when it comes to that. And it's exciting to me because I get to feel like a radio host or something. But actually, the first question of this episode is from David. It's from David Brown. Again, always been a good supportive follower of the forensic stuff that I've been doing for a while. And he has a great question. And that is, have I been a part of an exhumation case? So first of all, yes. And second of all, first of all, I think everybody knows what exhumation means, but in case you don't, that's when a body has been buried and taken back out of the ground and then sent for an autopsy. Sometimes that body has already been autopsied, and sometimes it has not been autopsied. In my case, I have been a part of both kinds of things, where the body was not autopsied, and other times the body was autopsied. And these cases are very different. They involve there's a lot on the legal side. You have to get all the permits to exhume. It's very expensive. It's time intensive. I mean, you literally have to get a backhoe, go to the grave, dig it out, dig the coffin out, send it over. And I got to tell you, depending on the length of time from which the person was buried to when I see it, sometimes the coffin has been breached by groundwater. And I've opened up caskets where the body was covered in fungus, and covered in mold. And of course, if they've been embalmed, even if they've been embalmed, that stuff still grows in there. These cases give me great anxiety because of the concentration of embalming fluid. It is an overwhelming smell. And of course, embalming fluid is a carcinogen. So I usually have not just an N95 mask, but I usually have an actual, I think they call it a P100, or like a gas mask type thing, where it filters out the gases. And so, but it's also very uncomfortable on your face. So I usually wear a P100. And then the second part that's really crazy about these cases is that because the body has been embalmed, it is extremely firm. So tissues that are normally soft, even brain, is hard, like a hard wax. And so I know the listener is and the viewer is probably saying, well, so what? You got a scalpel, just cut through it. You don't understand. It's an autopsy is very easy on a fresh body when you have a sharp scalpel. But when you have a body that is the consistency of wax, basically, or a very tough, dense tissue, it is exhausting for your hands and your arms to open that body up and actually get the tissues to move. For instance, when you do an autopsy, usually open up with like a Y-shaped incision, and then the flap of the chest goes back over the face. Well, in a person who's freshly dead, that's a very easy thing. It just sort of flops back and you don't have to think about it. But in an embalmed body, it's like the thickest piece of leather that you've ever seen, and you're trying to open up the tissues and keep everything apart so that you can do the dissection. So you have this carcinogen, you have this strong smell, you have the waxy body, and you still have to do the full autopsy. You can't do toxicology because the blood has essentially been drained and replaced with embalming fluid. So toxicology stuff, unless you're going to do hair and you're going to look for ingestion of, a poison like arsenic. You can also get drug testing from hair. You're looking for certain drugs like cocaine or morphine or things like that. But I'll speak specifically about a couple of cases that I've done, and not to completely take over, Jesse, but I, I've had some interesting exhumation cases. One was a medical malpractice case where the
Ooh.
lady went to surgery. She died during surgery, and then the family kind of didn't know what happened or know what to do. So they just said, well, okay, we're just going to have a funeral. We're going to bury her. They buried her. And then after thinking about it for a while, they realized that the explanation that they got for why she died wasn't very good. So they hired a lawyer. And then that lawyer hired me to say, I need to find out why this lady died. So the body was exhumed like 3 or 4 years later, and I can't reveal the nitty gritty details of the case, but I will say it was a surgery involving the thorax. And I had to document all of the surgical interventions within that thorax. And by the way, kids, if you want to be a forensic pathologist, that's why you still have to know about surgery, because you have to look at the work that a surgeon has done and understand what is happening, understand how to document it. So sometimes people say, I want to do forensics because I don't want to do all that other stuff. Sorry, you still have to know it. That doesn't mean you have to be good at it. It doesn't mean you're going to do a heart transplant. Yeah, it doesn't mean you have to do a heart transplant or you have to do a lobectomy of the lung, but you at least have to have some basis for what that means. So I went in, documented everything. It did appear that there was an error, but I do not make that determination as a pathologist. I say, here's what I found. You give it to your expert surgeon on your side and see if they think it's an error. And then that surgeon will give an opinion that says, I think this is an error. The case goes to the civil trial, the malpractice trial, and the family actually wins. The doctor lost the lawsuit. The family won. I think they got like 8 figures out of it. And so that's where an exhumation, post-surgical exhumation, 4 years later, gave justice to the family for something that was a medical error. Now, I will also say, as a postscript to that, that these are extremely uncommon. A lot of people will say, oh, well, medical errors are the number 3 cause of death, blah, blah, blah. It's not true.
No.
I have been in this field for, no, I have been in this field for 11 years now, and I have probably on one hand the number of true medical errors that resulted in death. So that's, 3 to 5 out of 3,200 cases, something like that. So, but it is worth investigating. And I think I have another question maybe for this episode where I'm going to talk about that just a little bit. So I'm not going to get too in deep. And another case I did, now this is one that will probably in some way show up in a book that I write about my career someday. I actually did an exhumation on a case 40 years old. The body was buried. The autopsy, long story short, it was a body found in a cornfield with a gunshot wound in a rural Indiana county. Nobody knew who the body was. It was a Jane Doe. And they buried the body in like 1976, I think, or maybe it was 74. But nonetheless, I did the case and found, I redocumented the gunshot wound. I did as much description as I could. But this body was encased, and I say encased in grave wax. That's the term we love, grave wax. It was adipocere. And that's because the casket was very shoddy. And in that area, there's groundwater and 40 cycles of freeze thaw. because in the summer it gets very hot in Indiana, and in the winter it gets very icy and very cold. So this was a block of grave wax with a skeleton embedded in it. And I had to dissect that out. And let me
Sometimes
tell
they
you,
do call those
probably
soap
the most
mummies.
difficult autopsy I, yeah, well, it was the most difficult autopsy I've ever done. This was like, and this is kind of a weird, cheesy example, but it was like when Han Solo was encased in carbonite in Star Wars, in Empire Strikes Back, I think. And yeah, it was. That's exactly how it was. And I had to dissect away all the what would be carbonite, except it was actually adipocere. And so, most stressful and difficult case of my career. But I went ahead and found the mannerist homicide, gunshot wound, cause of death, gunshot wound to the head. And that was a very interesting exhumation. But I believe that case still remains a Jane Doe. Um, the case occurred reasonably close to Chicago. And so the leading theory at the time is this is a person who was murdered in Chicago, driven out into the Indiana cornfields in the 1970s and dumped. We can't prove that, but that's the thought. And there were some theories on who it could be, but as far as I know, as of press time here, I don't know who that was. I don't think they did the ID on it. But yes, to answer your question, exhumation cases, I have been a part of them. They are extremely not fun, but we can learn a lot from them. And Jesse, have you been able to do one of those or
No, I'm
more than
actually
one of those?
incredibly jealous that you have. Because you know, from an anthropology perspective, older remains are fascinating to me. And yeah, I
Hmm.
love that line of forensics. But in speaking of kind of, you saying it was 40 years old, Jane Doe. So there's different. I was
Hmm.
at a forensic conference this weekend. Dr. Forensic pathologist Dr. Christopher Rainwater gave like really, really awesome presentations about identifying and like all of like the collaborative effort it takes sometimes when a case is
Hmm.
that old. So I just kind of I'm glad you brought this case up because I kind of wanted to give people like primary, secondary, and then contributory like modalities of ID. So obviously, primary would be fingerprints, comparative radiography, which is X-rays, those kinds of things.
Hmm.
Dental comparison. So those are primary. Secondary would be visuals, DNA, surgical plates, and other hardware that has serial numbers. And then contributory would be anthropological, biological profiles, facial approximation, and media attention, kind of like America's Most Wanted, making somebody's face or as close
Hmm.
as you can get a facial approximation, a way the public can see it and possibly identify or recognize it. And then forensic investigative genetic genealogy, which is I feel like that one's pretty recent, right?
Yeah, it
Yeah.
is. And in fact, yeah, it's interesting. I didn't know you were going to mention that stuff. And the very last one you mentioned, genetic genealogy, is what they were going to try on this 40-year-old cold case that I did. That was kind of their the final countdown for what they were going to try on that case. And I know those results can sometimes take a long time.
Right.
I haven't heard about any updates on it. I certainly will make a podcast or we will update if I can find out more about that case, if they ever made an ID on that case. But I know that they were trying as hard as they could to get DNA out of that case. They were
Mm-hmm.
also going to try genetic genealogy. But yeah, there's a lot more modalities now than there used to be.
Yeah.
And certainly some of them in this case, you would not be able to use. For instance, fingerprints would not be an option in a body
No.
that's essentially a block of adipocere. Uh, and some people, pronounce it adipocere. That's fine. Don't
I
freak
was gonna
out.
say
It's just like,
I pronounce it like that, and I was like, wait a minute, I've been saying it like that, and he hasn't corrected me.
we
Now
go
I'm
back, we
hurt.
go back to the duodenum, duodenum, adipocere, adipocere. I don't really care. I'm not trying to be mean about it, but I think that it's the reason why I bring it up is because a lot of times the people who will correct who try to like write
Right.
little snide comments about, stuff in the podcast. They won't comment on anything, but they'll comment on like the pronunciation of something that was said incorrectly. And to
Right.
me, there isn't really an incorrectly. If you say autolysis instead of
That
autolysis,
would bother
that's
me.
incorrect.
Yeah, that would bother me.
Yeah. Uh, if you say apoptosis instead of apoptosis, that bothers me.
Or
But anyway, I
personal one of
digress.
mine is psychopathy. It's psychopathy.
Oh,
Just flow through
yeah.
the word.
I like the sound of that. I like that sound of that word psychopathy. I like the
Yes.
the way that flows.
Yes.
Anyway, yeah. So exhumation cases, um, I dread them, but I do about one a year. And I've had natural deaths. I've had suicides investigated to be homicides. Sometimes it's a case where the family just wants to get to the funeral. They want to bury the body. And then a few weeks later, they start to think about it and they go, you know what? I'm not sure we got that investigated properly. And then that's where the exhumation comes in. So in my practice, which is, I would say, a moderately busy practice, I do about one a year on average. Now it's 2025. I haven't had one yet this year. So I still have 6 weeks or so to get an exhumation. I'm really hoping not with it getting cold again, but we'll see how it goes. So
I
yeah,
just
I
wanted to
mean,
say
this,
one thing in
yeah,
regards to cold cases and people trying to get into the line of work that we do. Volunteering to work cold cases is an excellent way to get into the like a position within a coroner's office. Those are so backlogged and they need help, and a lot of it is just talking
yeah,
to people. To be honest with you, it's like not there's not fancy ways of identifying people at that point, especially like you said, if it's 40 years old, just you have to work the case, you have to talk to people, you have to follow leads. um
yeah,
and I think people get better at that with social media for whatever reason. There seems to be a lot, like a fair amount of like internet sleuths. But it's like
yeah,
if that's
yeah,
something you're truly interested in and you want to help people, find the identity of a Jane Doe or a John Doe, that's a really good way, is to go and see if you can volunteer with detectives and help them work cold cases.
yeah. I mean, certainly, and offices, as you will see as a recurring theme when we talk about forensics, offices are understaffed,
Hmm.
pretty much across the board. Most offices don't have enough volunteers, death investigators, or forensic pathologists. That's just a fact of life in the United States. I wish it was better, but um, like Jesse said before, the death industry is not really well funded because it's seen as something occurring after the fact. Like we want to save lives, and after those lives are lost, well, do what you have to do, but we're not going to give you much money for it. I mean, like for instance, and I've said this number many times, the United States has about 500 board certified forensic pathologists, but by the estimates that I've seen, I think through NAME, the National Association of Medical Examiners, they say that we need about 1,500 to cover all
Yes.
the work.
Yes.
So we only have a third. And you can imagine that the death investigator situation is the same. There's not quite as many because most of these people aren't doing it full time. They're doing it as a second job in some offices, particularly in the smaller to medium sized offices. That's kind of a second job. So, we're always trying to encourage people to go into the forensic field, and certainly getting in and just volunteering is a good way to get your foot in the door. All right. So, you want to move on to the next question,
Certainly.
Jesse?
This is from Brandon Gillespie. Forensic photography. You just put etc. on that one.
Yeah. Yeah, this was the show notes. The show notes. Yes, Brandon was asking about just kind of the elements of forensic photography, as I understood it, and just how does that work? Who's seeing it? How do we decide what to photograph, things like that. And I know that you were interested in kind of taking the lead on that
I
question,
mean, I
and
can
I certainly have
certainly,
thoughts as well.
yeah, I can take the lead a little bit because I did take a pretty hefty crash course in forensic photography, and then I did it professionally. So I think one of the questions I got from another person as well was, is film still used versus digital? And it kind of
Mhm.
same thing like we were talking about, like different offices have different, some of them are, like I said, are more archaic than others. So some of them do use 35 millimeter still, which was kind of like a standard
Mhm.
back in the day for forensic photography. Especially, I think now it's still used because the contrast for fingerprint photography, um, 35 millimeter is still
Mhm.
very valuable for that. And there's also like this thought that forensic photos taken on film can't be faked, whereas there's some
Yeah.
perception of faking it with a digital camera. Or
Yeah.
yeah, so certainly depending on your office, you may still be using 35 millimeter film. So, but it's a little bit different because I think the question was, what's the difference between artistic photography and forensic? And forensic is, you're
Mhm.
not trying to create any type of perception and you're not trying to conceptualize any artistic vision. You're trying to put somebody actually in your head, literally through your eyes, looking at the scene as you work it. So, what did the scene look like when you approached? Especially with digital, you cannot take too many photos. That's what I was told. Um,
Yeah.
there's all kinds of things that you could miss possibly, like just, if you feel like you should take a photo of something, my personal advice would be take it. You can't, like I said, if you're using a digital camera, you cannot take too many photos of a crime scene. um, and then I will actually post
So yeah, and mhm.
sorry, I'll post
Go
my
ahead.
notes that I took for principles of forensic photography, so you can see like the breakdown. But the three
Yeah.
main principles are: fill the frame, maximize your depth of field, and keep the film playing parallel, no angles.
Exactly. Yes. And first of all, let me say that now I don't see anybody using film around here. We are all digital in
Mm-hmm.
Indiana. I have never seen anybody use a film camera. We use all digital, and we I will say that there's the scene exam photography, which may have different principles from the autopsy exam photography. I, of course, am not at the scene. I know some forensic pathologists probably go to the scene. It's not practical where I work because the pathologists here, including myself, will cover a very wide area. So, you can't really get up and drive an hour and a half in the middle of the night. They can't just wait on you to take photos at a scene or something. But those, like she said, with digital, you can't take too many. Now, even though as the pathologist, I don't want to look at a ton of photos, it's important to have that record because these cases, some of them will go to court. And you have to have things accurately represented. Make sure the lighting is good, make sure it's not blurry, things like that. And sometimes there's a little detail. This is why taking extra photos is always a good thing. A little detail in the photo, maybe a little bottle of medication sitting there on the counter, or maybe over in the corner, there's, perhaps you see a knife handle or something underneath the table. So I have gone back, I look at photos on every single case. Every single case I do, I look at photos, and every now and then I will see something where I say, "Hey, you need to go back to the scene and check that." I think I had one once where it was a case where it was a surprise choking case. So I did
Surprise
the
choking.
case and I found a chunk of meat in it. Yeah, I was surprised because this guy was found dead and they thought it was a drug OD. And I found a chunk of meat in his larynx. And I looked at the photos and I said, "Now wait a second here. Is that a bowl that was sitting next to him on the couch?" And then they went back to the scene, and the guy was eating like a bowl of some sort of vegetable beef soup or something. And initially they thought it was a drug OD, and it turned out that he had these big chunks of meat in his soup bowl, and he didn't have very good dentition. So when you don't have good dentition, you can't chew up your meat very well, and if you're eating it very fast, these people get choked. So that's just a mild example of where forensic photography at the scene was helpful. But now I also want to address the autopsy part because that's what I know about.
Hmm.
And there was another question similar from a Sarah Sandreesen. I hope I'm saying your last name correctly, Sarah Sandreesen, who also asked about forensic photography and kind of like who's seeing it? How are we directing it? Is the jury seeing it? And I'll tell you my philosophy on it. When it is time to do an autopsy, as the pathologist, although I am not a photographer in that sense because I'm all gowned up and gloved up and I really need to do autopsy, I personally see myself as the director. Like if I were to get a credit for the autopsy, this would be the director of photography, Darin Wolfe, because I have to be able to put that case together in a certain chronological order. I have to be able to put it together to show every bit of evidence. So if there is anything I am even remotely interested in, I have the photographer, which is in our case, usually it's just a deputy coroner with a digital camera. I come up and I say, you need to photograph this because I know that in about 2 years, I'm going to be sitting in a courtroom and I'm going to have to look up at a screen and I'm going to have to know what's on that screen. It can't be bad lighting. It can't be on the screen without some frame of reference. Usually, what we do is we take a long shot to show where it is anatomically, and then we'll do the close up after that. You always have to have a scale in your photo. Usually, I have a 6 inch or 15 centimeter ruler that I measure everything with. It also helps to have the name or the case number there as well, so that people know you aren't like faking the photos and switching them in from another case. Um, because that's important when it comes time to go to court. And so I think Sarah's question was, well, who eventually sees it? Um, and the answer is the judge, the prosecution, the defense, and all of the jurors. And not only that, everybody that's in the audience, at least in my state, the judge will usually give a statement, and he or she will say, "We are now going to see autopsy photos. So if you are squeamish about this sort of thing, now's the time to leave." And sometimes you'll see people get up and leave, and other times people will sit there and watch. And usually we have a big screen. Even in the old stone courthouses of small Indiana towns, we will have a big screen with the autopsy photos. And let me tell you, earlier in my career, I didn't understand the importance of good forensic photography. But boy, after you go to court and you're trying to squint to see that gunshot wound or that stab wound because it's dark or the body's turned or something, you realize really quickly you got to become a good director of like cinematography or something. But yeah, I like you said, right angles, good lighting, always a scale, always a long shot and a short a close up, and usually multiple of each doesn't hurt because eventually those are going to be looked through when you go to court. A lot of times I'll do a pre-trial where I meet with like whether I'm working with the prosecution or the defense, and we go through and we select the photos. These photos represent the gunshot wounds for Mr. Johnson, and we're going to put those up on the screen. And then I have to go through and I use those as a teaching point to the jury. So that's how the forensic photography. I find it to be immensely important. And when I started my career, I was all, hey, autopsy, all that matters. Everything that I see and document is all that matters. And I'm sort of a little bit, not appreciating maybe how the forensic photography needed to be good. And now it is so important to me when I am in an autopsy. I am thinking already of the trial, and every photo we take, I am picturing myself in trial. And I think that's a good way for the deputy to think. And also, if you're a forensic interested in being a forensic pathologist or you're a trainee, think about yourself in court and not looking stupid. That's the number one thing you need to do. So yeah,
Uh,
that's kind of the basic forensic photography stuff.
yeah, in our
Go
case,
ahead.
same thing, like you were saying, the deputy coroners sometimes will be the ones doing forensic photographies. Bigger offices have directors of forensic photography, with like really highly specialized, designated people that do that. But there was as an autopsy technician, that was one of my jobs, was the photography. And, I was lucky that I had people that really knew what they were doing that could teach me. But I mean, that just became, the photography became a part of the autopsy. So we did, like, for, however long it would take, before the autopsy started, before we even, got into anything else. It was me and doctor, and we would just walk the body, and she would, anything that she was interested in, we would take photos. And that was the start of the autopsy, was the photography.
Yeah, and the way that I look at it is anything that you think you're going to put in your report, it needs to be photographed.
Mm-hmm.
I think that's the best way to do
Yes.
it because a lot of times also when you go back and particularly in complex cases, those photographs are an absolute gold mine. So if I've got a case that's maybe, 10, 12, 17 gunshot wounds, at the time of autopsy, I'm fairly certain where everything's going, but sometimes you need to go back and look at those photos. And if you have a bad set of photos, you are going to do poorly. And if you have a really good set of photos, you can reconstruct that crime and those injuries really well. So, what I do, and this is just an aside, I don't mean to do an entire lecture on this, but if I have a gunshot wound, what I do is I have the photographer take a picture of every single anatomical structure from the entrance to the exit. So, like, we'll go in through the skin, we'll get that one, we'll go into the subcutaneous tissue, through the muscle, in through the bone, in the organ, out of the organ, like if it's a lung or something, and all the way through. And you might have 8 or 10 photos of one gunshot wound, but it's much easier to trace out that path when you do that. So
Right.
yeah, a big fan of forensic photography. I didn't really have any training in it other than just being a fellow in forensics and seeing actual professionals do it. Because I did my training in a large office in a city of 1 million people. And so they had folks in there that were seasoned, very seasoned individuals, CSIs who were, very good at taking photos. And everything I learned about it, I learned from them. Number one. And then on number two is when you go to court, and if you see a set of bad photos, you know exactly what you need to do next time you have a case. So, and that does happen to everybody. Any other comments on that, Jesse?
Not really. Like I said, I'll post the notes that I
Okay.
took on forensic photography if anyone's interested. So that way, you can just copy my notes. But yeah,
I think that's a good thing to post. And you know what we might do? I'll look around through some of my files, and I have like copious amounts of files. And maybe I'll show an example of like a good photo and a bad photo, and we can kind of put those up as well at some point. Just for folks who might be interested, because we're here to inspire. Okay, so we're gonna move to the yeah, we're going to move to the next question, which really is there's two questions. One was from Philip Petrie, the other from Ash Barton, that kind of ask the same thing, which is usage of masks and PPE, and are there conditions that we are taking extreme precautions for?
I was excited
So
about
I'm going
this
to
one
tackle both
specific.
of those.
Yeah, I was excited
Yeah.
about this one specifically for one of the diseases that you put here. So I'm ready.
Yeah, yeah. Well, so you got first of all, as a just a human being, not even a doctor, I am a bit of a germaphobe, and I have been my whole life. So for me, every patient has HIV, tuberculosis, and hepatitis C. Like to me, that's what they have. And so I gown up. Usually I'm wearing, of course, I wear, for my PPE, I wear shoe covers, I wear a surgical gown, I wear a pair of cut gloves. We call them cut gloves, where they're like a really thick, cut resistant pair of gloves. And then on top of that, surgical gloves. Sometimes sleeves on top of those if you're going to be really like deep in the body, you want to cover up your forearms. A N95 mask usually. Sometimes it's a KN95. Sometimes it's a P100. Sometimes it's an N99. Um, Face shield, very, very important. Probably the most important thing is the face shield because you're getting, preventing splashes. And then like
Hmm.
a hairnet, something to cover, which of course I don't have to worry about too much. But I do like to cover my head.
Decomp
So
days are
that's my
doubling your
basic
nets.
PPE. Decomp days, certainly if you are a person with long hair, I know a lot of the ladies that I've worked with, their hair will smell like decomp after decomp cases. And so they have to go home and shower and, get that smell out of their hair. And also out of your clothes too. It'll be in your clothes. But in terms of conditions, there are a couple that come to mind. Well, first of all, it very obviously anybody with COVID or flu or any kind of respiratory disease, I do take precautions. So one of the questions was, do we have to worry about respiratory illnesses? And the answer is yes. You do. I mean, the person, and I've had people argue with me about this. Usually they're people that aren't in the field, but they argue that, hey, the person isn't breathing, so who cares? Well, the thing is, the infectious organisms are still in there. And for instance, when I take a lung out, if you squeeze the lung, you are creating a breath. You are creating a puff of air coming out of the lung when you transect the bronchus. So when I have a highly infectious case, sometimes I will clamp the bronchus with a large hemostat before I take the lung out. People think that that is overdoing it, but again, better safe than sorry. I'd rather not get that. So I do that sometimes when it's a RSV, flu, COVID, that type of thing. And also, we use a suction hose a lot during autopsy. If a person has like a lot of pleural effusions, pericardial effusion, a lot of blood in their chest cavity, if we're not measuring it, um, you have to use a suction hose, and that will produce aerosols. So if there's a lot of infectious organisms in that fluid, you're producing potential aerosol. So yeah, I do worry about that stuff. But there's two big ones for me that really, really concern me. The first one is tuberculosis. Now, not extremely common in the United States. Used to be very common, 100 years ago, 150 years ago, tuberculosis was a very common thing to get. And it's more common in areas of the world that don't have quite good sanitation. They're quite crowded. Most of the cases we see here are folks who have traveled to those regions. And I, you know, I always take precautions, but one case that I read about, and I believe it occurred, the paper was written in, I'm wanting to say Wales or somewhere in England. And what happened is they had a case, they brought the body in, pathologist starts the autopsy, and there was 8 visitors in the room. And they were just sort of at the, against the wall, past the table. They do the autopsy, and I think 2 of them are wearing masks, and there's 8 that aren't wearing masks. And what happened was the pathologist got in there and then they realized, uh-oh, this looks like tuberculosis. They realized they're dealing because there's certain manifestations in the lung that will tell you that it's going to be tuberculosis and you have to start being concerned. So they move on. They say, don't everybody, get your masks on and all that stuff. Well, as it turned out, later, whatever, a month or something later, these folks actually came down with tuberculosis. They were positive for TB and they had to go undergo all of that drug therapy for 6 months. And they were just standing in the room of a person dead who had tuberculosis. So yes, these diseases can spread through the air, and TB is the number one you have to worry about. So that's why N90, some offices mandate N95s because of the TB issue.
Yeah.
Um, and I always look for it. I'm always concerned about it. And I pray that I never get it, but it is something you have to think about. So anybody who's visiting your morgue should have a mask on, at minimum a surgical. It would be preferable for an N95, but a KN95 maybe. But that case scared me when I read about it, the paper of that one. But there's one thing that's so much worse. And this is the prion disease known as Creutzfeldt-Jakob. Okay. So I know some of you are already cringing in terror as I say those words. And some of you are saying, What did this guy say? What is he even talking about? Well, prion disease is the great terror of my life. Okay. In fact, in my book, The Handbook of Zombie Forensics and Medicine, the causative agent for the zombie apocalypse, in my opinion, would be a prion. It is an infectious piece of protein. Okay. It is not a bacteria. It is not a virus. It is not a parasite. It is neither living nor is it dead. It is a piece of protein that, when it lines up with similar proteins in your brain, it reconfigures them and it produces a
Yikes.
horrific, yes, a horrific disease, which is called Creutzfeldt-Jakob disease, but also you may know it by a different name, which is mad cow disease. That bovine spongiform encephalopathy is what that was called, due to contaminated beef in Europe, namely the United Kingdom, in the 1990s. What happens was when they were slaughtering these cows, apparently they had some cows that had bovine spongiform encephalopathy. It occurs in the spinal fluid and in the brain tissue and in some of the other tissues, and got made into hamburgers and whatever type of beef products they were eating. Folks ate it and then they came down with this disease. And this is not a disease that you come down with and come back from. When you have it, you are dead. You are dead. And it is a very terrible way to die. You develop cognitive changes. You develop ataxia, which is difficulty with movement and walking, movement disorders, hallucinations, seizures, because your brain is actually being destroyed by this replicative protein. It's just changing all the other normal proteins into prion proteins. That's why they call it like a zombie agent. And not to make light of that, with the zombie being like a fictional thing, it is a great concern because there are multiple types of prion diseases that occur. Kuru, for instance, is one
Hmm.
of them. Scrapie in goats is one of them, and sheep.
Chronic
Um,
wasting disease
but
is
it's
the
all chronic wasting, exactly. So she said chronic wasting disease, which occur in deer and elk, which may or may not be able to cross over into humans. And so there have even been people suggest that neurodegenerative diseases such as Alzheimer's may be related to this. Now, I don't know what the evidence is. I am not a neuropathologist, but people have suggested that some of these neurodegenerative diseases may also be prion based. Um,
I know a
it terrifies me.
neuropathologist. We could have her on to talk
Yeah.
about it.
Well, actually, that might be a really interesting episode
Hmm.
to have some other folks on here to talk about stuff because I learned about this disease. First of all, I was in college in the 1990s. And when this came out, when this disease first came out, I was horrified by it because I was like, well, why couldn't that happen here?
Right.
That was my thought. And thankfully, we haven't really had any issues with that here. But as we continue to remove regulations through the U.S. Department of Agriculture, I personally think that it is going to come back. It is going to occur here. And the problem is there's no good test for it. So you can't just, let's just say, test a herd of cattle really easily with like a saliva test or something, or let's test the milk or something. Um, at least I'm not up on prion testing as much as probably some of the prion scientists are, but it's my understanding that it's not that easy to test for, and you generally can't diagnose it until you have to get an MRI or you do the autopsy, and you
Hmm.
get the diagnosis from autopsy. But it is a terrifying disease because there is no cure, there is no treatment. And the progressive nature of the disease is very rapid. Usually, once the symptoms start, you've got less than a year, and it's a lot of suffering. So I have been worried about this disease, and we used to talk about it in medical school. And there was a guy I knew who became a neurosurgeon, and he swore off meat. He's like, I am not going to ever eat meat again. I am too worried about prions. So he's even more of a germaphobe than I am.
Yeah.
But yeah, this is something. This is one. So the ultimate question is, they're asking, do we take extra precautions? Well, I will tell you this. The first thing I do is I say to myself, is this a case that could have Creutzfeldt-Jakob? So if I am presented with a case where the person has had a very rapid decline in their brain function, they're having loss of bowel and bladder function, they're having hallucinations, they're having seizures and things like that. They've lost 100 pounds, and they're like 40. You have to start thinking, now, wait a second, could this be a prion disease? I have had cases, a handful, where I said, I'm not doing this autopsy because you have to have a certain type of facility and a certain type of PPE. And generally, I think there's only a handful of facilities in this whole country that will take Creutzfeldt-Jakob or prion cases. And you have to wear like an astronaut suit, like a space
Yes.
suit. I don't
Yeah.
know if you've ever seen it.
Yeah.
Um,
We sent one away once for that because that's right when you said, um, I'm not going to do it. And it's, goes back to funding. Nobody
mhm.
in these small offices has the funding to keep them safe with the equipment needed to do this very complicated, very problematic autopsy. So no, it's an automatic.
Well,
Yeah.
yeah, exactly. And the other thing is, we're still learning a lot about this disease because it's so rare. It is 1 in a million people spontaneously. So we don't have a lot of cases hanging around. And therefore, it's difficult to study. And also, if you are in a lab that studies it, that is a very dangerous thing to study.
Yes.
So it's not like studying, yeah, it's not like studying Staphylococcus aureus, where you can just grow it on some blood agar and, look at it under the microscope and do your molecular tests. This is a very dangerous, it's not even an organism. It's literally just a piece of protein that causes these issues. So yeah, that's the one thing where you have to have a sense of, could it be? And if it is, don't do it. Unless you are at a facility where you have highly trained people. And sometimes there will be facilities. I remember when I was a medical resident, when I was a pathology resident, we did have a rule out Creutzfeldt-Jakob case at my hospital, and the autopsy tech there did the case. He put on the spacesuit, he did the case, he took the brain out, and then they sent the brain to, I think it was Case Western Reserve, in my area that do those, which I think is in Ohio. And but he did the case, and I was like, "No thanks, man. I'm going to be waiting in the break room, and you let me know when you're done." And the issue is, well, the other issue is here, you can't just bleach, okay? You can't just spray Clorox or something like that on it. There are very specific ways. Well, let me put it a different way. If a neurosurgeon has a case that could be Creutzfeldt-Jakob, you have to throw all the surgical tools away. Generally, they don't even
No,
reuse them
yeah,
because there's
not
such
even
a,
autoclave,
yeah,
just done. Absolutely not.
yeah.
Not coming back.
Yeah, autoclave is a way that we sterilize tools, usually high pressure and high heat. Will kill all the viruses and all the bacteria and all the parasites you can imagine, but it will not affect the prion. There are certain protocols to sterilize, and I don't remember it off the top of my head, but it's something like sodium hydroxide, which is a strong base, phenol at boiling temperatures for like several hours. That kind of chemical treatment can get rid of it. So it's actually easier to just get rid of the tools than it is to sterilize and keep using them. So yeah, that's the one disease. And let me tell you, we could do a whole podcast on it or a whole series on it. I talk a little bit about it in my book, which you can buy at Amazon.com. You can go there and type that in to your search engine of choice. Type in my last name, Wolfe, Wolfe, and zombie, and it will be the first hit. It's a green cover, and you can order that and read it and learn a little bit more about prions, because my theory of zombieism is that it will be a prion that causes the apocalypse, and hopefully it doesn't get too out of control. I will say this: I am not a vegan, but I personally have noticed a change in the quality of any beef that I've eaten in the last couple of months. It's not good. It has a strange texture to it. So I completely stopped eating beef because the thing is with this, you don't get it and then you have like a cold the next week and you know you have it. You find out like 2 years later. You find out like 6 months later or 8 years later. So if it occurs, we're not going to know about it until it's too late and we've already
Exactly.
ingested it.
Yeah.
So not to scare you guys, but yeah, not to scare you guys, but I stopped eating beef when the USDA decided to stop. Uh, I don't know exactly how their policies have changed, but all of our government policies are being um, kind of like shredded,
Yeah,
and
completely
these things
eroded.
are
They're just rolling
in
back regulation and protections. Like,
yeah, and these things are in place to protect the public. Because we don't want people to have prion diseases because we don't even know how a lot of them spread. So this is the most terrifying thing for me. I just hope it doesn't pop up, but I'm waiting for the news story to pop up, and then I'm going to say, "Aha, I knew it." Um, but yeah, that. So long story short, prion diseases and TB are what I'm most worried about when it comes to autopsy. And also, we have to consider, and I will tell you this as my bottom line, the philosophy of the pathologist and the tech and anybody in the room is that I don't care what the patient is or any of their medical history, you have to assume that they have an infectious disease. Hepatitis, HIV, tuberculosis, you have to conduct yourself like they have an infectious disease, period. Because it may seem like a little 81-year-old granny that never did anything, but how do you know? How do you know what they've done in their past? An 81-year-old in 1980 is very different than an 81-year-old now. I mean, they had different habits and different social lives, you know. So now you can't use that. Like in medical board exams, they would typecast people. And if it was a young person, like a young male with a cough, you had to start thinking about HIV. But now it's anybody can have anything. So you just have to be careful, is all. Anything else on that, Jesse, that you wanted
no, I was
to
just going to say
say?
the same thing that you did. Just the assumption is that everyone has everything. And if you just kind of approach your case with that thought, you're probably good. I mean, obviously anything can happen. It's a dangerous job, but you're going to be a lot safer if you take standard precautions rather than just, getting too comfortable.
Yeah. And I think most people react the way that we do to the concept of the prion. Most people in medicine
Yeah.
are horrified by it. And it's one of those things that when people do videos about it on TikTok or Instagram or whatever, they always get like a million views because a lot of people just don't understand it and they're very intrigued by it. But the more you learn, the more terrified you get. I certainly would not want to be anywhere near it in a lab or anything. In fact, sometimes I think about it and I'm like, man, I just want to retire and do something that doesn't involve opening people's heads. Every time I open somebody's head, I'm waiting. I pull the calvarium back and I'm like, am I going to see this spongy brain and go, oh my God, this is it. I'm
Right.
done.
Oh my god. Oh
So
my god, this is it. Kind of killed me.
I
um,
think about it every time I pull someone's calvarium back and I look at the brain, I'm thinking, is this it?
right. I mean,
But anyways,
yeah. I
yeah.
the other thing
So
about, rolling back protections and regulations and all of that. So, I mean, that talking about prion diseases when it comes to beef in that regard, there's also the fact that, and I don't know how much literature you've read on this, they've been dropping the age for routine colonoscopy screenings. And one of the things that they've been noticing is
mhm.
that the tumors um, or growths that they're finding in younger people tend to look like tumors on chickens that have been like mass treated with antibiotics.
Oh my gosh. No, I have not seen this.
I'll
Yeah, I
send I'll
know
send you
that
the
we're
paper.
seeing it a lot. Yeah.
Yeah, I'll send you the
No, I would be
paper.
interested to read that. Well, yeah, they move the age lower and they're finding more, of
Mm-hmm.
course. As you move the age lower, you're going to find more. And if you moved it to 40, you're still going to find more. But it's one of those things that it's quite scary when you think about the amount of cancer that we have. I mean, anybody can speculate on what is causing that. And I'm a surgical pathologist too, so we can do some episodes on cancer and stuff like that as well
Hmm.
in the future. So just message us and let us know what you'd like to know about, and I can certainly talk about that. I have one more question here. I have one more question, and this is from the old call out that I put out a couple of years ago. This was from a user with the handle J.A. Finney, and she said, was asking a question rather on how to obtain an autopsy if one suspects medical malpractice. And one thing I'll say about this is something that could definitely be its own episode. And I will tell you that I am sometimes contracted to do cases for suspected medical malpractice. Those don't often come through coroner offices because we usually do those. Coroner offices are like, people found dead in their home, people who were shot, people who were in a car accident. They're not terribly often people who were in hospitals getting treated for whatever, or getting some kind of surgery. But these cases are very difficult, legally speaking, but you have to have a good autopsy. And so a lot of the times these are private cases from families. You have to first of all suspect it, and some folks will suspect it even when it's not there. And we can't know, obviously, until I look at the medical records and do the autopsy. And the problem with these cases, from the pathologist's perspective, is that sometimes the medical records are 1,000 pages long. So, how am I supposed to review 1,000 pages of medical records prior to starting an autopsy? It's very difficult, if not impossible, to do. So, you have to be thinking about it as, but the issue is, a lot of families, they don't have anybody medical in their family. They don't really know if there was a malpractice situation. So, I don't think it hurts to get a second opinion on a case. I think that the way to think about it is if there's even a 1% to 5% chance that you think this could be malpractice, don't bury the body. Don't have a funeral and bury the body. Because doing it as an exhumation makes it like 100 times more difficult. So I would say, you don't always need to have a funeral right away. Those bodies can be refrigerated. You can wait 7 days, although it still makes it more difficult for the pathologist. But certainly, unexpected deaths while undergoing a treatment, I think, deserves an autopsy. And that would be one criterion I would use. Um, I would say that some folks are overly suspicious because of the myth that medical errors are the third leading cause of death. That is actually not true. Um, at all. I don't even know where to begin, how that rumor started. Some kind of paper that was published a few years back, and it dealt with, therapeutic people who were dying during therapeutic interventions. I mean, people are in the hospital for sepsis, and you use vancomycin and you try to kill the bacteria, and they die. They probably didn't die from the vancomycin. They probably died from the bacteria, but then that gets marked as a hospital death. So
Very
then
similar
it
with
gets
remdesivir and
misconstrued.
COVID.
Yeah, well, actually, it's that's a good point that you bring up, because I have had more than a few cases where the family has asked, "Can you please do an autopsy? I know they were killed by remdesivir. They were in the hospital with COVID. They got remdesivir and they died." One case occurred 4 years later. Like, the guy got remdesivir in 2021. He died in 2025, and the wife said, "I know remdesivir is what killed him." Meanwhile, he died of a heart attack. I mean, just, as a postscript, I'll tell you he died of a heart attack. And so, um, certainly there's multiple pieces that you have to have when you're doing a malpractice case. One is you got to get a pathologist that's going to do it, that's independent. You got to get the medical records. You have to have a lawyer. Okay, you need to get a lawyer who can arrange this. So very often what happens is I get a call not from the family, but I get a call from a lawyer. So usually the family will call an attorney and say, I'm worried about medical malpractice. The attorney will then call me and say, Dr. Wolfe, do you think that you can do this autopsy? I will then usually call the family and I will talk to them. And if they say something like, well, dad was 88, he had diabetes, hypertension, COPD, and severe atherosclerotic cardiovascular disease, and he died during an aortic stenosis procedure. That's a case where I'll say no. That's probably not why he died. That is a case where if you do an autopsy on somebody who has that many chronic conditions with such a difficult open heart surgery, the odds of dying are very high and the odds of it being an error are very low. So it's going to be kind of a waste of your time. But if it's somebody who, let's say they went in for a carpal tunnel release and they were 39 years old and they died, well, now that needs to be autopsied because why did it happen? Was it the anesthesia? Was it a surgical issue? Or was it an underlying medical condition? So, I personally find those cases to be among the most difficult cases in my entire career. And I do cover hospital autopsies at two of the largest hospital systems in Indiana. And I would say more than maybe a third of those, the family suspects that there is a malpractice issue, and I have to do those cases. And very often I'll find that it is not malpractice. And unfortunately, people don't like that answer. But I am an independent pathologist, so I don't even work for the hospitals. I contract with them, so nobody even really knows me there. I just sort of come into the morgue and do the case and leave.
You're just that haunting
But yeah,
figure that
medical
walks in every day.
malpractice, it's true. I'm like a ghost. And the morgues are always like in the basement. And so I like come in, grab a key in the lab, head to the morgue and do an autopsy by myself in these old like 50, 60-year-old hospital morgues, which personally I kind of like actually. It's always very quiet and recessed somewhere in the hospital away from actual patients because they don't want us to see, they don't want the patients to see any dead bodies being wheeled
Exactly.
through the halls. But yeah, I mean, those cases are sometimes they're hard to know for the family what to do. I should probably make a YouTube video or something on what to do if you want to have a malpractice autopsy. But generally, you have to have an independent pathologist. And I will tell you that those cases are very expensive. And that's usually the number one reason why families decide not to do them because they are very expensive. Most pathologists won't touch a case for under $5,000 if it's a medical malpractice issue. So some of them will even be a lot higher than that, and some families just don't have the funds for that, and that's just the nature of it. And although that sounds like a very high amount, it's actually not. When we do these cases, we usually do more work than what we billed for, because very often these cases will have thousands of medical records, thousands of pages of medical records, and we have to spend like days and days and days going over every line of the medical records. So, not my favorite cases, but they can be rewarding. Certainly, if I feel like I can help a patient. I don't know if you've seen any malpractice cases where you've worked or medical related type cases, Jesse.
No, there was only two. The one that was like that stands out the most in my head was I think I told you this in one of our other episodes, but it was
Hmm.
a doctor that was very, very dismissive of a woman who came to the hospital
Hmm.
in a tremendous amount of distress. He dismissed it as both drug seeking and the fact that and thinking that she was currently on drugs. She was actually septic and the
Hmm.
sepsis had spread to her brain, obviously.
Oh yeah.
And so he noticed these marks on her hands and feet, and he said that they were like marks from using or something like that. I don't totally know how he could have
Hmm.
mistaken that, but they were Janeway lesions, which is attributed to bacterial endocarditis.
Hmm.
So he sent her home, and she
Oh
died.
yeah. Hmm.
And yeah, but it was nice to be
Wow.
able for the pathologist to let the mother know that she was not on drugs. It was just, it was a
Yeah.
complication of using drugs in the past, certainly, but it was not she wasn't using at the time, and that was a very, very unfortunate
Right.
case.
Because they get that endocarditis and they get these vegetations on the
Hmm.
valves,
Hmm.
and those little vegetations can collect bacteria. And then those bacteria, as the heart beats, they can break off little pieces and the bacteria can go out into the bloodstream. And then, if the conditions are right, then they get septic.
Hmm.
So yeah, that's unfortunate. I have seen a couple of those.
Yeah,
They were
and
a
that's one of the
lot more
reasons why she was
common.
behaving so erratically too,
Yeah.
was the sepsis was in the brain. So I mean,
Right, right. She had sounds like an encephalopathy,
hmm.
But yeah, so very interesting stuff. I don't think I have anything else to add uh, on that particular question, and that is the totality of the questions that I've received so far. There were a couple. I will say this: there were a couple I received that I think because they were legally sensitive questions, I can't really answer them publicly.
Right.
So we're going to
Hmm.
defer on those. I'm not going to go into any detail. And if somehow we missed your question, please message Jessie at Knife After Death at the Instagram account and let her know, and then she can let me know, and we'll address it because, like I said, we'll do another Q&A at some point.
Yeah, these are
But
fun.
yeah, thanks for yes, thank you. I mean, they're actually nice for us because we don't have to plan the content very much. We just answer the questions, and they're much easier to film. We don't have to do like outlines very much or anything like that beforehand. But yeah, thank you for all your questions. We really appreciate it. We hope you guys enjoy the stickers. We're still working on designs for more merch. I mean, what we really want is to have some more art involved in this because we both like art. I love creating art, and I love that kind of aesthetic that involves, bones and anatomy and old surgical textbooks and things like that. So we're going to try to hopefully have some stuff. I would love to be able to do some designs over the next week, and then maybe we can get a shop up by December so that you guys can, have your Christmas gifts and your other holiday gifts for your family. Nothing says nothing says I love you like autopsy merch.
Right. Nothing says I love you like here's a
I,
skull.
you know what? I designed a shirt once and I didn't get to print it, and it says autopsies save lives. And I thought that was going to be a great shirt, and I didn't get around to making that one. So perhaps we can put that up on the shop
We
when
do,
we
because
do.
I would totally
Yeah.
rock that. That's an awesome
I
shirt.
would too. I would too. And the funny thing is, the font I used for it was Cooper Black, which is the Garfield font. Yeah, exactly. So keep in mind we're gonna try to do this. We'll try to get some items up for you guys and gals. But anyway, thank you for listening, and we have some good episodes. We have some cool stuff planned for the rest of the year. Hopefully, we can get everything that we want to get by the end of 2025, and then
I'm
hopefully
determined to make this happen.
more technologically advanced in 2026. And, who knows? We might even show up at one of these crime cons or one of these conventions that talks about forensics. Certainly, that would be interesting to talk to you guys in person. Although I am kind of socially awkward, so maybe I would have Jesse do the talking. But,
I mean, I'm just here
you
to
know,
balance you. You'll be fine.
yeah,
Then again,
exactly.
what is an autopsy assistant for? So we'll figure it out.
Yeah, truly, truly. Well, anyway, as always, give us questions, concerns, comments. You can message directly Knife After Death at YouTube, and then the Dead Letter at Instagram, Facebook, or TikTok. My book is The Handbook of Zombie Forensics and Medicine, which you can find at Amazon or any retailer that you type into. The book is actually released, I believe it was released almost exactly 6 years ago today. So it's not new, but it's still kind of an interesting read if you haven't read it. It deals with zombies, of course, but you also learn a lot about medicine and forensics and public health in the book. So I think you'll like it if
I
you
loved it.
haven't
That
seen it
was actually how
already.
I found you. So
Um, yeah, there you go. See, I'm famous now because of it. So we will talk to you next time, and thank you for listening. and watching.
Say, did you ever hear the saxophone let out an awful moan?